Welcome to all of you who have joined to listen to this webinar. My name is Shekhar Saxena. I work for Harvard University and I am privileged to be the moderator for this edition of the COVID-19 and Mental Health webinar series, which is organized by the United for Global Mental Health, along with Lancet Psychiatry, MHPSS Net, and the Mental Health Innovation Network. These webinars have been organized since April, and now in this phase of the webinars, they are once in 2 weeks' time. Today's topic is substance use and mental health, challenges, opportunities, and lessons during the COVID-19 outbreak. I would like to explain that these webinars are recorded, and also the recording as well as notes are later put on the website. You're most welcome to ask questions in the chat or send it by email to COVID-19 seminars at unitedgmh.org, or also have discussion on the social media under the hashtag COVID-19MH. We have an excellent panel today, and I would like to introduce them and then introduce the topic a little bit more in detail. So we have Olga Belyaeva, who is the program coordinator of the Eurasian network of people who use drugs. She represents people who have expertise by experience. We have Nirvana Morgan, who is the president network of early career professionals working in the area of addiction medicine. Welcome, Nirvana. We have Alexander Baldacchino, who is professor of medicine, psychiatry, and addictions, St. Andrews University Medical School, and he is also the president-elect of International Society for Addiction Medicine. Welcome, Alex. And finally, we have Vladimir Poznyak, who's unit head, Alcohol, Drugs, and Addictive Behaviors, Department of Mental Health and Substance Use, WHO, Geneva. Welcome, Vladimir. It's a nice pleasure to welcome Vladimir, who I have spent a lot of years working with when I was working for WHO. So some of you might ask, why substance use in this series of webinars which are focused on mental health? Some of you know that very well, but I'll just explain in brief the rationale for having this particular topic, which is the first time that we are covering this topic, as to why it is part of these webinars. When we say substance use, we mean alcohol, which is also a substance, drugs, including prescription drugs, and all other psychoactive substances. And obviously, all of these substances give rise to mental effects. In fact, people take them to alter their mental state. So obviously they have a connection with our mental health, but also if people take more of these drugs for more length of time, then they give rise to disorders like substance abuse, harmful use of substances, as well as dependence, which are all mental and behavioral disorders under the International Classification of Diseases. In addition, there are a lot of comorbidities. People who use substances also have a large proportion of them have mental disorders, and vice versa. People who have mental disorders tend to use substances more often. In addition, services in most countries are organized under the same umbrella and manned by womaned by the same people, the same professionals who are often psychiatrists, psychologists, and addiction medicine specialists. And finally, substance use is also affected by COVID-19, just like our mental states are, which will be explained more during the webinar. So these are some of the reasons why we thought it is quite important to cover this topic, and hopefully it will be worth your time to spend on this webinar, which will last 45 minutes. With that introduction, I would like to begin the discussion, and my first question is to Alex. What are the interactions that we observe clinically in population experiencing mental health and substance misuse related problems? And I have explained some of them. You might like to add to that. But more importantly, what has been the impact of COVID-19 pandemic on the population who uses drugs? Alex, please.
Thank you very much, Professor Saxena, for that introduction. And I'll follow on to your statement around comorbid conditions, especially comorbid mental health and substance misuse, is that these conditions tend to occur concurrently and or successively, and may or may not be causally related. But I'll focus around the effects COVID-19 did put on this population, which, as you said, is quite a significant number of individuals attending addiction services and mental health services. And I think COVID-19 has actually accentuated the disparity, the inequalities of this very vulnerable population who are experiencing complex clinical situations. And there's been quite a number of factors during the acute stages which has compounded this vulnerability. And they include the fact that systemic-wise, during the acute stages of COVID-19, there was a reduction or none of any of the signposting where these people can go and ask for help. There's been physical structural obstacles in attending their usual services. And that might also include a reduction in the crisis centers in order to support these people during their own acute relapsing stages. There was a reduction in capacity in staff, quite an increase in flexibility in delivering certain services. So complex populations like this, comorbid patient populations tend to have quite a raw deal. A reduction in contingency, what happens if situations do not work well? What is the information that we have and should have given to these vulnerable individuals and populations? But lastly, systemic-wise, there was an increase in stigma. So these are people who have already been stigmatized, and with the COVID-19 situation, stigma has increased. And that resulted in an increase in psychological conditions, their own situation, being in lockdown during the pandemic perpetuated their own psychological situation. And also, not to forget that their own physical condition, which they were already predisposed to experience more cardiovascular and other physical conditions, have deteriorated. Last but not least, there's been an increase in overdose and suicides in this population.
Thank you very much, Alex, for explaining that. It does seem very obvious that people who use substances are undergoing a lot of issues during the pandemic, more than the general population, and these are often neglected when countries plan for services. I'll turn now to Vladimir and ask a question. Vladimir, I know that WHO has been at the forefront of the health response to the pandemic. Just half an hour back, I was listening to Dr. Tedros, the DG of WHO. But in the area of substance abuse, what are the key messages which WHO has passed on to the governments as well as to the populations? Could you summarize these?
Thank you very much, Dr. Saxena. And first of all, I would like to refer our audience to the website of the World Health Organization, where they can find a very comprehensive guidance on all issues related to prevention and management of COVID-19. But if to speak about our area, alcohol, drugs, and addictive behaviors, our messages were developed mainly for several key audiences. It's for general public, it's for people with health conditions caused by alcohol, drugs, or addictive behaviors, and for policymakers, regulators, and service providers. And let me highlight several messages. It's impossible to cover all of them, but I would like to highlight several messages that we developed for general public and we communicated to general public. One was that, and that was particularly relevant at the beginning of the pandemics, that neither alcohol use nor use of other psychoactive substances can be preventive for COVID-19, can have any prevention potential for COVID-19. On the contrary, they may interfere with individual prevention measures, like, for example, compliance with hand washing recommendations or with physical distances, etc. Also, the harmful use of substances can increase susceptibility to all infections, including potentially COVID-19, though we still don't have sufficient evidence to make any firm conclusions on that. If to speak about hence our message was, if you use substances, keep it to the minimum. If you don't use, don't start, and avoid using substances during the COVID-19 and the lockdowns. I would like to highlight one message that could go unnoticed that we included in our messaging, and that was to be aware of potential increase in the marketing of alcohol, video games, and online gambling, and to protect vulnerable individuals, families, and communities from the impact of these marketing activities. For people with health conditions due to substance use and addictive behaviors, our messages were focused on the need to continue with treatment, to keep in touch with a therapist or support groups, need to continue with prescribed medicines, particularly important in treatment of opioid use disorders, and to be prepared to prevent and manage such acute conditions like overdoses, drug overdoses, and acute substance-induced health conditions. The main messages to service providers and to policymakers were to uphold public health policies and regulations, but at the same time to ensure continued access to critical interventions for people who use drugs, who have substance use disorders, and for this purpose, it might be necessary to adjust existing treatment policies or regulations. And the messages included on take-home medications, on ensuring access to medicines in hospitals, for example, with hospitalization with COVID-19, in prisons, in nursing homes, availability of medicines and naloxone, particularly for opioid overdose management, and access to essential harm reduction services in the communities. Thank you.
Thank you, Vladimir, for this very comprehensive summary of the key messages that the WHO is disseminating. If I can just ask for a short supplement question. You have made these guidelines, you have put them on the website. Do you have any feedback from countries and people as to whether they are actually taking note of it and following these?
We had several channels of communication, and these channels included not only WHO platforms, but also the platforms of Interagency Standing Committee on Mental Health and Psychosocial Support, which is a committee which is responsible for advice and messaging and guidance on psychosocial responses to emergencies. And we expect that through all these platforms, and including social media, we had a very good reach out to the audiences. Also, WHO made all the efforts to involve as many stakeholders as possible in disseminating WHO messages to the public. Thank you.
Very good. Thank you so much. And this certainly will be one of the webinars by which you are disseminating information to many people. I know that more than 550 people registered for this, and I believe several hundred people are online now. Many more will perhaps watch it as a recorded version. So you are doing a good job for WHO, Vladimir, I must say. Thank you so much for a reply. I now turn to Olga and ask a question. From the perspective of people who use drugs and related services, what are the main challenges with regard to their health and well-being during current times? Olga, please.
Thank you. As Kofi Annan say, all diseases are treated by doctors except of drug addiction. The police works here. Just a bit about the context in which we are living. The familiar drugs, psychoactive substances in the illegal drug market have been replaced by synthetic. Instead of opium, we must buy the crystal methadone or fentanyl. We have a lot of trouble with alpha PVP. Alpha PVP we use together with cocktail of nalbuphine, nalbuphine, lidocaine, dimidrol. This is in injection, and medicine contain codeine and pregabalin. This is the oral. What Vladimir said about the recommendation, if we use drugs, we should reduce the dosage. Unfortunately, I can do it, and my friends can do it with drugs which we don't have addiction. But the drugs which we have addiction, this is the drugs that we can use more and more, increase the dosage because the high level of stress. Stress, in order to explain you, substitution therapy consulting room can be located as a building of morgue and work at from 6 a.m. only for 45 minutes. The highest dosage of methadone is 20 milligrams. Or you can hear from your doctor such sentence: get on your knees, apologize, then I'll give you methadone. You should realize one point, highest important part of our life. We usually have two options. We use drugs for reducing soul and body pain, or we use drugs to have the balance with university. But we have the different goals with doctors. Usually our doctors set himself the goal of treatment, the absence of drugs in our urine. Our goal is to get high without harm. I agree with Alex Baldacchino, who said about the increased overdose. 70 people died in Dnipropetrovsk, where I'm here now, Ukraine, during the 1 month of quarantine. When we thought and asked people about what previous this, how it's happened, most of people have the high level of stress because of the social problem and medical problem, but without any connection to mental health services. Thank you.
Thank you very much, Olga. You have brought out the points of access to medicines, access to services, and also the problem of having unrespectful services, which WHO has always emphasized, that the services need to be delivered with dignity and respect for everybody, including people who use substances. So those are really essential principles which you have highlighted very well. And I hope some of the service providers and government representatives are listening so that they can actually correct if there are problems in delivering services, especially in an environment which respects the people who are receiving the services. So thank you for pointing that out. I now turn to Nirvana, and the question to you is, what are the challenges which treating substance use disorders in daily medical practice, especially in low resource settings? What are you hearing from your fellow providers during these times?
Thank you, Prof. I think there's several challenges, but I'm just going to highlight maybe two key challenges today. To illustrate the first challenge, I'd like to just share some basic findings from a PhD study that I conducted here in South Africa. I recruited or interviewed 300 heroin users when they entered an inpatient rehabilitation facility. I then re-interviewed them 3 months and then 9 months after they left the facility. At 3 months, I managed to see 84% of the sample, which was 252 heroin users. And of these, 2 had seen a psychiatrist, and this was after leaving the rehabilitation facility, and 3 of them were on any form of psychotropic medication for psychiatric comorbidities. Almost none had had an HIV test or hepatitis test, and the overwhelming majority were not even retained in any form of aftercare in outpatient or inpatient treatment. This didn't occur because this cohort of heroin users didn't have psychiatric or medical comorbidities or didn't need aftercare treatment. This occurred because services were so fragmented. Blood tests could only be offered at a local hospital or primary healthcare clinic. There was no psychiatrist available at the rehabilitation facility, and aftercare services were also not available at the rehabilitation facility. The user would have to locate a service on their own within their community. And so what I'd like to highlight is that there really is a difficulty with providing comprehensive service where all comorbidities can be treated concurrently and where there's a continuity of care. I think in some regions, people with substance use disorder can only access treatment in a psychiatric facility. However, herein also lies several challenges. Especially in lower resource settings, there's a high threshold for entry into a psychiatric facility. So only a person really with substance use disorder and a severe mental illness may be able to access treatment. There's also a really serious issue of stigma within the psychiatric community towards people with substance use disorder. For example, when I was a resident in psychiatry, I could admit up to 20 people on an overnight admission to the admission ward. However, the next morning, many of those with substance use disorders were discharged. They were seen as less deserving of a bed within the psychiatric ward or not the responsibility of the health sector. And so I think the key challenges, especially in lower resourced areas, is access to treatment and then also the quality of the service that is offered when somebody can access treatment.
Thank you very much, Nirvana. You have brought out the difficulties in accessing treatment in a country like South Africa so eloquently. I'm sure the situation in many other low and middle income countries is very similar, if not worse. So this round of questions have come out with a lot of issues which providers are facing, which people who use drugs are facing, and overall in the health system. So I now turn to Alex to answer the response to some of these. What would you suggest should be the major systemic responses when delivering services for substance users? And what have we learned from the acute stages of COVID-19 epidemic situation now? Perhaps the principle of building back better, which has been so much talked about in mental health care, can be applied for these kind of services also, or not?
I think the simple answer is yes, if you try. I'm going to share with you some results of a survey that the International Society of Addiction Medicine has conducted 2-3 weeks for a month during the acute stages of COVID-19. And we asked 170 clinicians from 70 different countries. And I'm glad to say that the results are very much echoing what we are all saying here. But I'll share with you the 5 recommendations that were evident for the clinicians who were trying hard, continuing a service which was considered in most countries as an essential service during the uncertain times of the acute stage of the COVID-19. The first one is interesting, is what you, Professor Saxena, asked Vladimir around the guidelines, is that everyone was aware of the guidelines. Everyone was aware of the different guidelines that are available in the different parts of the world. There were several guidelines there to support addiction services, to support individuals, but few actually were able to implement these. So in a sense, one of the recommendations was around how can we make things better in order to translate more effectively these guidelines. The second one was very much around a systemic response, which is based around providing adequate support to service providers, commissioners, governments, and other stakeholders to establish a meaningful business continuity plan. We have learned a lot from this acute stage, and we can, and perhaps, might learn from how we can preempt and be proactive in delivering a business continuity plan around establishing and delivering a service for people with substance misuse and/or substance misuse and mental health problems. The third recommendation was around contingencies in providing adequate supply of medication. And it is very interesting that some of the countries who responded to the survey said we had the guidelines, we had the contingency plans, but then suddenly, because of unrelated circumstances such as transports, pharmacies not opening up, etc., there wasn't an adequate supply of medication. Fourthly, is what Olga, I think, had intimated, is that we should include, and I know the WHO has been very positively vocal in this direction, we should include harm reduction strategies as integral to an evidence-based service, evidence-based treatment service, rather than a notion that harm reduction is there when treatment fails. Last but not least, and I think this is also important, is that we during these acute stages we tend to forget vulnerable populations, and especially in the respondents, the majority said we tended to forget the migrant population in this thing. What was interesting in all these 5 recommendations, there was a significant disparity between high income and low income countries who responded to the survey. So I hope that answered your question, Sekar.
Yes, thank you very much. Your 5 recommendations are very much answering what needs to be done. And I hope some other listeners will actually note these, and they will also be part of the notes from this webinar and try to follow these. This actually provides me with a very good continuity to ask the next question to Vladimir. We do know that a lot needs to be done for substance use related services, but they also need to be integrated within the overall approach to healthcare. And WHO has been in the forefront of asking countries to implement universal health coverage. And WHO also has a special initiative on mental health. Vladimir, would you tell us to what extent substance use related services are part of these larger initiatives, and are they making any headway?
Thank you very much, Shekhar, for this question. And indeed, the mental health spatial initiative is one of the flagship, one of the most important recent developments in the World Health Organization. And it's one of the main objectives of this initiative is to provide ethical, quality, and affordable care for millions more people, millions and millions more people in different settings for mental health conditions. And this is entirely within the framework and within the concept of universal health coverage to all, which is promoted by the World Health Organization, which underlines exactly that, affordable and accessible care. The expression of mental health conditions as described in the Spatial Initiative on Mental Health includes mental, neurological, and substance use disorders. So in effect, the answer to this question is definitely yes, it's a part of that. And how it could be different when we know that we know about comorbidity that was mentioned in this conversation on many occasions. We know about the substance-induced psychosis. We know about substance-induced depressions, anxiety conditions, suicidal behavior. We know about the cognitive impairment and dementia due to use of alcohol and inhalants, volatile inhalants. So we know all that. And what Nirvana, I think, mentioned is that in low resource settings, it's a norm that services for people with substance use disorders are provided in psychiatric and mental health facilities, and be it outpatient or inpatient facilities. But what is more difficult, so yes, though, of course, it's a question what place these conditions would occupy in the implementation of the initiative in every country. And this depends very much on prioritization which is made in the countries. If to speak about the role of substance use in overall mental health promotion globally, which is also one of the objectives of Spatial Initiative on mental health, then the answer is also yes, definitely, because we know very well how substance use impacts mental health, well-being, educational opportunities for children, interpersonal domestic violence, community safety, and so on and so forth. So we all know that. Also, it's appropriate to mention substance use during pregnancy, etc. However, it's so complex and challenging and so difficult to implement preventive and treatment measures in a way that, as we underlined, it was underlined on several occasions, that fully respect the rights of people, fully respect the ethical principles, and at the same time are strongly based on scientific evidence. And also, it's challenging because we have 2 billion people using alcohol in the past 12 months. A quarter of billion of people use drugs in the past 12 months. These are the significant parts of the population. We really need very strong global partnerships and international collaboration to address all public health dimensions of alcohol, drugs, and addictive behaviors, and to make sure that mental health promotion strongly include easily identifiable and preventable factors which are related to substance use. And we have Sustainable Development Goals targets now up to 2030, and which these goals reflect the commitments made by the governments, by the different stakeholders in development. And there is one which is on prevention and treatment of substance abuse. And let's see what will be the progress achieved by 2030, and hopefully we will all contribute to this, to the progress made. Thank you.
Thank you, Vladimir, also for pointing out the need for taking a wider view rather than just providing services for promotion as well as prevention of many of the associated issues. I now would like to turn to Olga for a second question. You have very eloquently described the difficulties that people who use substances are undergoing now. I want to turn to you now to ask, what could be the possible role of service users and people who use drugs in shaping the response to substance use problems, and also in the context of COVID-19 outbreak? What can you and other people like you do? What would you like to do?
Thank you for your question. We think that we should start to transform the attitude to us and increase the professional level of our doctors. Because if we have in our country, we have in our region, in Kazakhstan, 10 years, during 10 years, the OST have been implemented. And even during the COVID, any pills to methadone can bring to hospital. This is a basic, essential medicine in WHO list. We advocate for the basic services. That's why I'm here. Community represent me in order I asking the experts who have time and who have willing to help us to connect together community and experts, and started to thinking what we can do right now in our countries in order to, in different situations, reduce the level of stress, reduce the negative attitude to people who use drugs among the expert community, medicine community. And this is my point when I am here. And if you, respectful audience, have such ideas on, you can help us. Enjoy, we are open to help you, to help us. Thank you.
Thank you very much, Olga. Your request is very well heard. Your being volunteering for taking part in the response is very well heard. In fact, I can ask a quick question to Vladimir. You always talk to the governments in any case. What attempts are you making to for governments to make better collaboration with people who use drugs when they decide about policies as well as the services?
Well, now there are several, I think, recent developments that are important in this case. And first of all, the situation on the major global platforms when drug policies are discussed has changed significantly. We have now very strong representation of civil society organizations in Vienna at sessions of committees on narcotic drugs, of Commission on Narcotic Drugs. And this is a very good development. When we have a possibility, in fact, we had a special session this March at Commission on Narcotic Drugs, when WHO officials met with the representatives of civil society, and many questions that Olga raised today in our conversation were raised also in these conversations, in presence of member state, of governmental officials. Another is the position of UN recent position of UN system on drug issues and drug policies, which pay a lot of attention to the role of people who use drugs, to their concerns and their voices, which is really critically important. And Shekhar, as you know, in WHO guidelines development processes, there is a requirement to have the people for whom the guidelines are being developed to be it's an absolute must to involve these people in the guidelines development process. So, of course, I cannot say that this functions absolutely perfectly in all cases, but definitely there is a requirement, there is a very clear guidance how to develop normative guidance in WHO involving people for whom these guidelines, in this case, it's people who use drugs when we are talking about any normative guidance on drug use disorders or management or harm reduction, etc. And I think this is a very good development, but as Olga already described, there's so much to be done at the country level. There's so much, it's so complex sometimes to ensure coherence of policy responses in different parts of the governments. Particularly, I'm talking about the relationship between public health and criminal justice sector or drug control sector. And these are all questions that don't have immediate silver bullets that can solve everything in 1 minute. But this is something that we all need to work together. Yeah.
Thank you, Vladimir. Thank you for taking this issue forward. I now turn to Nirvana and ask a question about the key challenges for young health professionals around the world working in substance use area and addiction, especially during the COVID-19 period.
Thank you. So our network of early career professionals working in addiction medicine recognized that many of our members were extremely stressed and under a lot of strain during the COVID-19 pandemic, and we held a series of support calls to support our members. We also conducted an informal qualitative survey to gather information. So I'm just going to mention a few of the key themes that came out of these support calls and the survey. I think the biggest overriding theme from early career professionals working in addiction medicine was that our members were really fighting for an equal space within the health sector during the time of the pandemic. I think some of our members expressed concern that senior management of hospitals or clinics didn't see addiction services as essential or necessary, and so services were interrupted. Some of our members, especially from lower income countries, were very concerned that their patients could not access any treatment because public transport was shut down. Most of our members reported that they were encouraged to take up telehealth services, so to contact patients via virtual mediums like Skype or Zoom or make telephone contact. However, once again, like Alex mentions, with the discrepancies in the lower resource communities, many patients don't have internet connectivity and couldn't be contacted even over a landline or a cell phone. And so there really was a worry on the part of our members of our organization as to how are they receiving any treatment during this time where they desperately do need it. Education and training, as Olga mentioned, is always an issue in addiction medicine, especially for early career professionals wanting to advance their education. And I think during the time of COVID, one aspect that was new that came up was training in the field of telemedicine. So, you know, what does a health practitioner do when they have somebody over the phone that's suicidal, has a plan, and then the call cuts and you can't get hold of this patient again. I think a scenario like this becomes quite overwhelming for a practitioner that doesn't have support or doesn't have significant training in telemedicine. Another thing that I think many people reported that they found frustrating was that they did not have equal access to personal protective equipment compared to other members within the health sector. And they felt that it was quite unfair that they were not able to protect themselves when they were dealing with a population group that was quite vulnerable and high risk. And then just to mention quickly, a last thing, but very important, was that we had a few members that report that many of the beds within facilities that previously were allocated to planned detoxification for people with substance use disorders had been reallocated to other services, for example, a COVID-19 screening ward. And so for now an extended period of time, these beds seem to have been lost. And I think that there are questions as to whether they're going to be returned to people with substance use disorder. These are just some of the few things that I can highlight in a short time.
Thank you very much, Nirvana. And I really like the way you answered, because it seems that the concern of the professionals is much more about not being able to deliver services rather than the concern of their own health, which obviously is important but comes later. So thank you for doing that. These webinars are supposed to be interactive. So let's take some questions from the audience. And I have a question which is about services in remote areas. And I'll turn to Alex to answer this question. How can we sustain and promote services for people who are in remote areas in either low and middle income countries or even in high income countries? Any tips?
Well, I suppose I think the one tip I would give is that we should provide a service that is, as Olga had said, co-produced and co-designed by the service users. So in remote countries, you know, the one important thing is to understand the populations that are going to utilize those services. So what does that mean? How can they deliver? And one thing that we have done in remote areas of Scotland is we, as an example, I'm not saying other countries should do that, because this is, you know, it's about geography, is that we have set up remote units, buses, vans, within which we went to regions and areas of deprivation, which do not have even the adequate transport system. So thinking around outreach, but co-designed and co-produced with the service providers.
Thank you. Thank you very much. And I suppose the other comments that we had earlier in the webinar about telemedicine and telehealth care would also apply perhaps to the remote areas as a part of the package. Obviously, that doesn't provide the complete package, but it could be part of the package. Thank you so much for answering that. My next question from the attendees is to Nirvana. And the question is, what are the options for quality inpatient substance use treatment designed on a harm reduction strategy and not only on a purely abstinence-based model in South Africa or elsewhere? And I remember that Alex had definitely talked about earlier about the integration of harm reduction strategies. How does it pan it out in practice in South Africa?
Yeah, this is such an important question. So thank you for whoever raised it. I think there are so many options available for harm reduction strategies. Several of the standard treatment guidelines produced by UNODC, World Health Organization, very well explain how harm reduction can be implemented. I think the problem is because of issues of stigma, because of sometimes lack of political will or resources, efforts are just not made to implement those strategies. So within an inpatient or an outpatient facility, we know that there are many harm reduction strategies, simple ones in terms of substitution therapy, needle exchange programs, screening for any medical comorbidities and treating those comorbidities that are highly successful, that have been showed. Motivational interviewing as a harm reduction strategy really retains people in treatment in a non-judgmental way. So I think that there are several options, and I think that we have the evidence that these work. I think we have very reputable organizations that have drawn up how these should be implemented, and I think at regional level, we just need to implement them.
Thank you so much, Nirvana. Seeing the time that we are now at 46 minutes past the hour, I would request the attendees to continue to ask questions. We may not be able to answer it right here, but they will be part of the notes, and also the discussion can continue on social media using the hashtag that I said earlier. But I would like now to, as a part of the wrap up, come to each of the panel members to say one key message which could actually be amplified very much in 30 seconds or less. And this time I'd like to begin with Olga. Olga, do you have a key message for our attendees?
Yes. My message to you, medicine experts, please give support for our friendly doctors. We have a lot of doctors in our Eastern Europe, Central Asian country, which can and willing help us. We need more information and more support from your colleague in the another country who can do it, who know how to organize this program. Professional approach and human attitude is the best you can do for reduce our mental health problem. Thank you.
Thank you so much, Olga. You have very eloquently talked about the professional approach, but also approach for keeping the human being in mind, which is very, very good. Nirvana?
I think the time for judgmental attitudes towards people with addictive disorders is over. And I think this addiction is a serious health issue and it should be treated as such.
Thank you, Nirvana. Alex?
I would echo what Nirvana and Olga had said, and not to be polarized with our views, not to think, and we started here with comorbidity, dual diagnosis. These individuals, if we truly have a patient-centered service, you realize that they have all sorts of multiple morbidities, social issues, psychological issues, and we should not homogenize our population because that would be the start of stigmatizing the same population.
Thank you, Alex. And Vladimir, you have the last word.
Thank you very much, Dr. Saxena. We are often saying no health without mental health. I would say that we should all realize that it's impossible to speak about mental health not addressing substance use and addictive behaviors. And also, one of the messages that with our colleagues within UN system we are promoting, we need to achieve the situation, and hopefully it would be soon, when drug and alcohol related issues will be considered as public health issues with similar approaches as to all other health conditions. We need to achieve this parity, and we need to do everything possible to do that. Thank you.
Thank you very much, Vladimir, for pointing out the need for parity. Mental health people are always talking about parity between mental health issues and physical health issues, and you have very clearly brought out the need for including substance use problems as a part of the parity discussion. Thank you so much. We need to come to a close, so I would request attendees to continue the discussion on social media, and also a reminder that the recording as well as notes will be available very soon from the United for Global Mental Health website, and also inviting all of you to the next webinar, which will be in 2 weeks' time. And the topic is tackling mental health stigma and discrimination. And this is co-organized with Time to Change Global. And I think, Vladimir, it will be important to remember that substance use issues should be included when we talk about stigma. Thank you, all the panelists, for joining us, giving your valuable inputs, and thank you all the attendees to having come to the webinar, and have a nice day. Thank you.